Performing basic first aid techniques. Our elderly clients are more prone to experiencing injuries due to accidents, surgeries, and illnesses. Since these situations cannot be totally avoided, we need to know basic first aid techniques that will serve as the initial response to those medical emergencies until full medical treatment is available. In this video, we will show you techniques in treating common accidents and emergencies and managing wounds. First aid techniques for common accidents and emergencies. Bleeding. In case of bleeding emergencies, make sure to wear gloves before applying first aid. Cover the wound using a gauze or a cloth. Put direct pressure to stop the blood flow. Do not remove the cloth. Add more layers if needed. The cloth will help clots to form to stop the flow. Burns. Flush the burned area with cool running water for several minutes. Do not use ice. Apply a light gauze bandage. Do not apply ointments, butter, or oily remedies to the burn. Assist the client in administering ibuprofen or acetaminophen for pain relief as ordered by the client's physician. Do not break any blisters that may have formed. Fracture. Do not attempt to straighten it. Stabilize and keep the limb immobile using a splint and elastic bandage. Apply a cold pack on the injury. Do not place the ice directly on the skin. Elevate the extremity using a triangular bandage or a big handkerchief. Assist the client in administering ibuprofen or naproxen as ordered by the client's physician. Sprain. Do not move the affected limb. Elevate it. Apply a cold pack to the area. Assist the client in administering anti-inflammatory medication as ordered by the client's physician. Nosebleed. Lean the client slightly forward, not back. Pinch just below the nose bridge. Do not pinch the nostrils closed by pinching lower. Check after 5 minutes to see if bleeding has stopped. If not, continue pinching and check after another 10 minutes. You can also apply a cold pack to the bridge of the nose while pinching. Wound management. Perform hand hygiene and wear the proper PPE. Stop the bleeding. Usually, minor cuts and scrapes can stop bleeding on their own, but you may also do this by applying gentle pressure with a clean bandage or cloth and elevating the wound until bleeding stops. Clean the wound. Rinse it with clean and running tap water. Wash around the wound with soap, but make sure the wound itself does not get into contact with soap. Avoid using hydrogen peroxide or iodine since they can be irritating. Remove any dirt or debris with sanitized tweezers. Clean the wound with saline solution. Apply an antibiotic or petroleum jelly. Apply a thin layer of antibiotic ointment or petroleum jelly to keep the surface moist and help prevent scarring. Certain ingredients in some ointments can cause a mild rash in some people. If a rash appears, stop using the ointment. Dress the wound. Apply a bandage, rolled gauze, or gauze held in place with paper tape. Covering the wound keeps it clean. If the injury is just a minor scrape or scratch, leave it uncovered. Change the dressing. Do this at least once a day or whenever the bandage becomes wet or dirty. Watch for signs of infection. See a doctor if you see signs of infection on the skin or near the wound, such as redness, increasing pain, drainage, warmth, or swelling.